Hi, I'm Dr. Chung. I'm the bariatric surgeon with Baptist Health Fort Smith. So obesity, as a bariatric surgeon, I consider a disease. Obesity is actually diagnosed by calculating out your height versus your weight. So when this number that's calculated out by a doctor or anybody who's qualified to do so comes up above 30, that's when you're considered obese. At this point, as a disease process, what happens is usually it can manifest as hypertension, diabetes, and what's been becoming a problem lately is that the number for childhood obesity is drastically increasing. I think the hard thing about obesity is knowing when to intervene. The problem with obesity is that it's a number that can be reflected at a younger and younger age now. So now we're finding people with ages of 10, 11, 12 that are considered an obese group, and the real problem comes in when they start to develop diseases like diabetes, and these are becoming more and more prevalent in younger ages. When to intervene for obesity for children, that's going to be determined to your PCP and your pediatrician. So having good follow-up with them will kind of help them progress and see when it starts to become a problem for your child's health. I think at the end of the day, the most important thing is for you to have your checkups with your PCPs and pediatrician. By doing so, it kind of gives you a clue as to when you should have that conversation with your kid. Because there's always this preconceived notion that having a little baby fat and all of that's okay, and that they might grow out of it, we always think to ourselves that we can wait. But knowing when to wait, it might be too late. So always having that honest discussion with your doctor and saying, is my child obese? Is he a little overweight? Is there anything we can do to kind of prevent it from progressing? That's the most important part. For patients under the age of 18, the most important way to address obesity is a multidisciplinary approach. You want to talk to your doctor, your nutritionist, to kind of identify the triggers that make you gain weight and address those first. So good dieting, even medications to help you lose weight will be first line. There's a lot of components that come together with obesity and genetics. So a lot of times there will be families that are obese that are more predisposed to having obesity-related medical conditions. So some of the way we actually promote weight loss is by promoting family support groups. So there are instances where I have family members, mother, father, and daughter coming together to get weight loss surgery together. And each of the patient is a completely different individual, and I address them independently, but I always do promote them supporting each other. I think when you make weight loss a goal for your family, there's a passion that comes with it, and there's an excitement that comes with it when you do something together. It brings family closer together, and I think whether or not you undergo surgery, whether you're doing a diet together, or whether you're making a goal to see a dietitian, nutritionist, or a pediatrician or a PCP together, when you do it together, there's a lot of excitement that comes with it. And when you hit those goals for your weight and you're all healthier together, I think that's something that really brings a family together well.